Hi everyone, welcome to Life with Kiari. It's time for a very long overdue update. It's been quite a while. First off, I wanted to say I'm still doing really well after my tether cord surgery back in May of 2022. So continued to experience improvements from that. Legs are working great, nerve pain down, sleeping better, all those good things. If you want more of an update on that, go ahead and check out my past tether cord videos. This video though is going to be a little different. One thing that did not improve after my tether cord surgery, unfortunately, was my bowel functioning. I have experienced severe constipation for many years now, and it's been a real challenge battle for me. I feel like I've tried everything under the sun to address the constipation, and today I wanted to talk a bit about how this process has gone with, chronic constipation, where I've ended up now. If you don't like talking about poop, I would suggest skipping over this one because we're gonna have a lot of poop talk here. So get ready. To start, I am about 1 week post-op from having ileostomy surgery. For those of you that don't know, an ileostomy is when they have to go in and take some of your small intestine, pull it out through your abdomen, and basically you put a bag on there and that's how you poop. I think most people are familiar with the colostomy bags. This one's very similar, except for instead of my large intestine, it's in my small intestine. So let me talk about how I got here. I mean, this was not an overnight decision. This was years of, trying fiber, trying Miralax, trying laxatives. I went through pelvic floor physical therapy. I've tried changing diet. I've tried medications that are supposed to help you go. You name it, I've tried it for constipation. Unfortunately, nothing has worked. I'm pretty sure because of years of having, a tethered spinal cord that was damaging my nerves, having syringomyelia, the cyst of fluid in my spinal cord that has also led to nerve damage, having Elhers Danlos Syndrome, which can cause a lot of gastrointestinal problems, having dysautonomia, which controls digestion, and having all that off. I'm pretty sure the combination of all those things eventually led to my large intestine basically shutting down. It just wasn't working. I went for a what they call a Sitzmarker study, where you swallow this pill with these little rings, and every few days they take an x-ray to see how the rings are traveling. After about 5 days, where the rings are all supposed to be evacuated, mine were still kind of spread all over my large intestine. They had not even made it close to where they were supposed to make it to come out, basically showing that my transit was extremely slow and I wasn't really moving. I'm trying to think other things. I went through a lot of testing, and after much testing, it just was determined that I was having sphincter problems with my muscles down there. They weren't opening and closing in a correct way to let me pass stool. So between the slow transit constipation and dysfunctional muscles in my sphincter, pooping was like impossible for me, and it was becoming very painful. It was just becoming a terrible experience for me and causing a lot of issues. And plus, on top of that, some rectal prolapse happening from all the pressure and constipation, hemorrhoids, a lot of not such fun things. I was in misery. I was at the end of my rope. I couldn't take it anymore. After much consideration, talking with my surgeon, I figured the ostomy was going to be the my next best bet. I just don't think I had any other options. I had tried basically everything presented to me, and this is where I ended up. I definitely didn't make this decision lightly. I mean, I tried everything to avoid it. I definitely had a lot of good cries about it, a lot of grieving. It was a hard thing to come to terms with, I would say. I was very scared to get this surgery. I just didn't know what it was going to be like on the other side once I had this bag attached to me and my intestines pulled. It just sounds terrifying when you really think about it. I guess, where am I at now? I'm a little over a week out of surgery. I'm feeling relief. I'm so relieved. I've been pooping, which has just been amazing. It's not painful. I'm not bloated. I don't have to sit here and figure out when and how am I going to poop this week, because that was just starting to cause like so much mental stress for me of like, how am I going to get it out? When am I going to do this? Whenever I would have to poop, it would like put me down and in bed for days, just having to recover, having to heal my butt up. It was really becoming very unbearable. Like I just couldn't take it anymore. So I guess the relief is amazing. The relief is amazing now that I feel that I like don't have to worry about all those things anymore. So I'll say that. Again, though, it hasn't been the easiest process after surgery. It's a lot of getting used to. It's a lot of my small intestine is still trying to kind of figure out what it's doing. I've had trouble, I've had some trouble with like now going the other way of almost having like diarrhea, getting dehydrated. There's just a whole rack of things now that I have to learn, and I have a whole new body, a whole new digestive system that I have to learn now, and I have to learn to manage. And I think in future videos, I'm probably going to get more into like what the recovery process has been like, things I've been doing after surgery to try to like manage the bag, manage my bowels, get things in check, because that's just a much longer conversation. But I mean, to start, I just wanted to give an update. I've been wanting to give this update. I just think I just didn't really know where to start with it all. I had to kind of figure out my own emotions about it. I guess I've been avoiding the update because I didn't really know how I felt about it. It's been very mixed emotions throughout this process, kind of like an emotional roller coaster at times of like, that relief and joy that I don't have to worry about this chronic constipation and pain anymore, but then some grieving of losing functions, adjusting to a brand new body again. I just having to go through a surgery again. And it gets old, it gets tiring, it's hard living with all these problems and disorders. And for anyone watching this that has some of these issues, I'm sure you know well, it's just surgery's not easy. And having to like pick yourself up over and over and over again can get tiring. So I guess all that to say, I'm here on the other side of surgery. I'm relieved it's done. I've been dealing okay with the bag. I've been getting used to it. I haven't been as like depressed about it as I thought maybe I would be when I woke up. Yeah, it's just it's going to be an adjustment, and it's going to be a steep learning curve. But basically wanted to give a little bit about what I've been going through, what's been going on. So please let me know if you have any comments, questions. I love hearing other people's stories too. Like if you have similar experiences, please share them with me. It just helps you feel less alone. Because when I've been like researching ostomies, you don't see a lot of people with tethered and Elhers Danlos getting them, or Chiari. I think you mostly see Crohn's, colitis, cancer, those types of things. So I've had a hard time finding others in my similar situation. So if you're one of those people, please reach out. It's just helpful to know you're not alone in this. And please ask questions too. because, you know, I've had to learn all about this. Like before all this, I didn't know so much about how ostomies worked. I didn't know about like I've had to learn about the digestive system and what your intestines do and all the jobs. So it's been a lot of learning, and I'm always happy to educate others and share my experiences. And I do this to help others so others don't feel less alone. So I guess that's going to be it for today. I just wanted to give an update, let you know how I'm going. At the end of this, I'm going to put some pictures up to show you my bag, show you maybe just a couple things. If you don't want to see pictures of things, then go ahead and end it right here. But if you do want to see some pictures, then stick around. And I hope to talk to you soon. And I will give you a little more info about surgery prep, what it was like when I was in the hospital, what I'm doing to manage things, and anything else you all ask. But for right now, that's just my update. It was good to get back on, make another video. Till next time, I hope everyone's doing well, having as pain-free days as possible, and I will catch you in the next video.